Measles, it's a word that feels like it should be in a history book, right? Something many of us hoped was a thing of the past. But it's seeing a really worrying comeback around the world. For any parent, knowing how to spot the signs and what to do next, well, that's your most powerful tool. So today, we're going to break it all down. And look, this isn't just a local headline. The alarm bells are ringing at the highest levels. The World Health Organization itself is sounding the warning, and that really underscores how urgent this is. It means that for parents everywhere, getting a handle on measles is more critical than ever. So that leads us to the big question, the one every parent is asking. How do you actually recognize this thing, and what can you do to protect your child? We're going to answer that by breaking it down into clear, simple parts, giving you the tools to spot the symptoms, care for your child, and, most importantly, how to prevent it from happening in the first place. All right, section 1. Let's start with the absolute basics. What exactly is this hidden threat we're really up against? Okay, so measles, or bent suri, as it's known in Vietnam, is a viral infection. But here's the thing you have to understand. It is incredibly contagious. Like, seriously contagious. It just hangs in the air after someone coughs or sneezes, and get this, the virus can stay alive and infectious on surfaces for up to 2 hours. You can see why places like schools or daycares can become hotspots for an outbreak. On to section 2. Now, to really understand measles, you have to think of it like a journey. It doesn't just show up all at once, it unfolds in these very clear, distinct stages. And knowing this timeline is the key to catching it early. Let's walk through this timeline. First up, you've got the incubation stage. This can last for up to 3 weeks, and your child seems perfectly fine. But here's the scary part. They're already contagious. Then, the onset stage hits, and it basically feels like the worst cold ever. We're talking high fever, a nasty cough, runny nose, and red, watery eyes. After that, you get the eruption stage. This is when that famous rash finally shows up. And then, finally, comes recovery, when the rash starts to fade and the fever finally breaks. All right, section 3. So during that whole journey, what are the specific red flags you should be on the lookout for? Let's zoom in on the signs that really scream measles. Okay, the rash. This is the classic sign of measles, but it's the pattern that's the real giveaway. It doesn't just appear everywhere at once. It follows this very predictable path, starting behind the ears and on the face, and then it kind of marches down the rest of the body over the next 3 days or so. The spots themselves are small, red, and a little bit raised, and they can even start to merge together. Oh, and here's a crucial clue. Unlike a lot of other rashes, the measles rash usually isn't itchy. But I'm gonna let you in on a little secret. A telltale sign that shows up before the big rash even starts. They're called Koplik spots. If you look inside your child's mouth, on the inner lining of their cheek, you might see these tiny little white spots, almost like grains of salt. They are a dead giveaway for measles. The tricky part is they pop up during that miserable bad cold stage and often vanish just as the skin rash appears, which is why they are so easy to miss. It's super easy to confuse measles with other illnesses, especially something like German measles or rubella. But if you put them side by side, the differences are huge. With measles, you get a really high fever before the rash. The rash spreads down the body step by step, and it leaves behind these brownish stains as it heals. Rubella, on the other hand, is usually way milder. The rash tends to pop up all at once, and it fades away clean, without a trace. Section 4. Okay, so let's say you've spotted the signs. If it's an uncomplicated case, your doctor will probably tell you to care for your child at home. So what does that actually look like? What do you need to do? Look, there's no magic pill for the measles virus itself. Home care is all about support, keeping your child comfortable and preventing things from getting worse. Step 1, and this is non-negotiable, is isolation. That protects everyone else from the virus. Next, manage that fever, but only with medication your doctor has okayed. Hydration is absolutely crucial. Push fluids, offer soft, easy-to-eat foods. Gentle hygiene, like cleaning their eyes and nose with a saline solution, can make them feel a lot more comfortable. And finally, vitamin A is a big one. Doctors recommend it because it's been proven to help reduce the severity of the illness and prevent dangerous complications. All right, now let's bust some common myths that can actually do more harm than good. There's this old belief that you shouldn't bathe a child who has measles. That is just plain wrong. Daily gentle bathing is really important for hygiene. Just keep them clean and make sure they don't get a chill. Also, don't coop them up in a dark, stuffy room. Keep the air flowing. And for food, just stick to simple, bland stuff that's easy on their system. Okay, section 5.
We've talked about home care, but that's only for uncomplicated cases. Measles can get very serious very fast, and you have to know exactly when to stop and seek immediate medical help.
So, where's the line? When does it go from a typical case you can handle at home to a genuine emergency? What are those absolute red flags that you just can't ignore? Okay, I want you to pay close attention to this list. If you see any of these signs, don't wait, call your doctor or head to the hospital right away. A fever that comes back or just won't break after the rash has been out for a couple of days, that's a huge red flag. Any trouble breathing, if they're super drowsy or confused, or if they refuse to drink anything, those are emergencies. These can all be signs of serious complications like pneumonia, and they need immediate medical attention. We've gone through how to spot it and how to care for it. But honestly, the real goal here is to make sure you never have to deal with any of this in the first place. And that brings us to our final and by far most powerful section, prevention. Let me be crystal clear about this. When it comes to measles, there is simply no debate among medical experts. The single most effective, most powerful tool we have to protect children from this really dangerous disease is the measles vaccine. It is safe and it is incredibly effective. So what does that actually look like? Well, it's pretty straightforward. The key is following the National Immunization Schedule. The first shot is typically recommended at 9 months old. Then, there's a second crucial dose at 18 months, which is often given as a combined vaccine. Getting both of those doses is what's essential for providing the best, most long-lasting immunity.
And we'll end with this powerful summary from Dr. Tao. Safe, cheap, and effective. You know, vaccination isn't just a personal choice. It's a community shield. It protects everyone, especially the most vulnerable kids who can't be vaccinated. Just remember, the absolute best way to care for a child with measles is to make sure they never ever get it in the first place. Thanks for joining us.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.